got to where I couldn't even stay on it 5 minutes.
In 2007, a leaky aortic valve stopped this highly active Girl Scout volunteer in her tracks. Even household chores were exhausting for 79-year-old Mary Ann Cahalan.
To make a bed, I would sit down 2 or 3 times.
Her age and a previous bypass surgery meant open heart surgery was not an option. At one point, the mother of 5 was given 2 years to live.
I came home and started cleaning out drawers and throwing things away and organizing stuff. I said, they don't need to have to do this when I'm gone.
But then she found out she was eligible for a clinical trial of a new procedure at Barnes-Jewish Hospital and Washington University School of Medicine. A procedure that's had so much success, the U.S. Food and Drug Administration recently approved it for all patients like Mary Ann.
Transaortic valve replacement is a groundbreaking procedure because it offers a potential therapy to many elderly and frail patients who have aortic stenosis and who aren't candidates for traditional aortic valve replacement.
This new method marks the first time doctors at Barnes-Jewish and Washington University are able to replace aortic valves without opening a patient's chest. In this procedure, they insert a new valve made of cow heart tissue through an incision in the leg or below the left breast.
Under X-ray guidance, we thread this up and then place this expandable stent inside your bad valve and then inflate a balloon which opens the stent, and then inside the stent then the valve starts working.
For many patients that leads to easier recovery and less pain. The second portion of the procedure is to avoid the use of cardiopulmonary bypass. So if we can avoid placing these patients on the heart-lung machine, that is keeping the heart beating, not stopping it. Obviously this physiologically is a preferable way to do, particularly in the elderly. And third, you want to do this in such a fashion that the patients can have the breathing tube out that afternoon and have a short hospital stay, typically in the range of 4 to 5 days. This is what we've seen with the transcatheter valve program so far.
While there have been updates in techniques and valves used in aortic valve replacements, the procedure had basically been done the same way for 40 years, until Barnes-Jewish and 22 other hospitals began a trial of this new method in 2008.
I was able to travel to France to train with a doctor who developed the procedure and came back here to St. Louis while the program was initiating. And over this last 3 years, I've actually been able to meet a lot of very interesting people who are incredibly happy that they feel a lot better after having this procedure done.
Overall, some 100,000 elderly Americans receive new aortic valves each year. 30,000 more need a replacement valve, but the risks of open heart surgery are too great. That's where this new method can save lives.
For people who have no operative options, I mean, not only are they high risk, but they have no options. This is truly can restore them to a level of life that they thought were going to be impossible.
Physicians at Barnes-Jewish Hospital recently implanted their 100th aortic valve using this new minimally invasive method, a milestone that gives this hospital the edge over those that can now begin using this new procedure with the FDA's recent approval.
That is a significant advantage, primarily in the level of experience. While it is simple in concept, there are multiple steps that require an entire team to perform well and perform well together. That in concert, the advantage of having done this now for the last several years, now that it's FDA approved, we feel that we can offer this technology perhaps past our learning curve, where we can offer the technology in as safe a fashion as possible.
The FDA only approved this procedure for patients who are considered high risk or inoperable. Physicians look forward to someday being able to offer this to lower risk patients.
It's a game changer because it improves survival, it improves symptoms, patients tend to live better.
That's the case for Mary Ann Cahalan. She felt better just days after getting her new heart valve.
If you talk to my husband, oh, he thinks it's a miracle.
Now she's back on the treadmill 5 days a week and looking forward to getting back to Girl Scouts and grandkids.
Everybody I meet says, your color is so much better. So much, you look so good. Well, I feel good.